It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
And hi again, everyone. Jim Knox along with Grace Sells. Welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
That's right, Jim. And up first on our show today, we're going to hear from plastic surgeon Dr. David Azouz and how he helped cure and remove excess skin after losing over 100 pounds. Let's take a look.
I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off, and I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
The two major groups of acne population that we see in our practice are teens, which is, I would say, about 60–70% of our acne patients are in their teens. And then about 30% of our acne patients are adult onset acne. These are people in their late 20s or 30s or even 40s.
My dream was to always become a model, and just dealing with acne, it's just like it affects me mentally, and it brought me my insecurity problems. And when I first met her at an event, she told me, it's okay, you're gonna feel beautiful one day. Whatever you feel right now, it's not gonna last for a long time.
Alexa is in the group of teen acne patients. She's had acne since her early teen years and is continued in her early 20s now. She has been treated in the past with multiple different types of skin treatments and medications as well. Typically what happens with her and most teens is that antibiotics or any topical acne product seems to work for a few weeks or a few months and it stops working. And that's the nature of acne, unfortunately. That's the nature of this condition. After patient evaluation and figuring out what type of acne they have, the treatment is tailored to address that particular patient's needs. In her case, we may use a combination of in-office procedures, antibiotics for a short period of time, and an anti-testosterone medication to reduce her testosterone sensitivity, and that's what has led to such great results with acne control in Alexa.
You know, I felt like an ugly duckling, like people were gonna judge me and see me like, you know, not as pretty, because nowadays it's all about image. You know, you wanna feel beautiful.
In my patients themselves, I see their personality change when their skin starts to improve. I mean, I've seen patients who are so shy that they avoid groups and crowds and they're antisocial almost, and their personality completely blooms when you improve their skin and appearance.
Today now, I feel a lot more confidence, and she's like done a wonderful job. I see a change, a big change now, especially from my before and after pictures. I feel like I can talk to anyone face to face. I feel like accepted. I feel like a swan.
Rachel has a question for Dr. Michael L. Thornton. How soon after breast augmentation or cosmetic surgery can I get in the water?
Basically, I tell all my patients about 2 or 3 weeks before you can get into the lake, the ocean, swimming pool, anything that's a body of water versus just a clean shower. Because we want to make sure that the scars are well healed, there's no evidence of infections, and there's no small openings allowing any of the bacteria to get inside. But typically, all of my patients can take a shower in their own house within 24 hours. They can get their scars wet. By specifically, I put brown paper tape and I put Dermabond over all those areas and keep them watertight so that they're fine taking a shower. But to get into a swimming pool or a hot tub or lake or something like that, I would rather them wait about 2 or 3 weeks.
To request an appointment with any of the amazing doctors that you see on our show today, head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. Now up next, we're going to hear from pain management specialist Dr. Jason Williams and how he can help anyone suffering from pain from bulging and herniated discs.
When patients come to see me, they're usually at a point where the pain is starting to affect their daily life, whether it be at work, their personal life, their moods, anything of that nature. They notice that the normal things that they used to do aren't really helping anymore, such as taking medicines that they get over the counter or going to see a massage therapist, chiropractor, acupuncture. All those things seem to be failing, even if they have worked in the past. So at that point, the patients are at a point where they feel that there's something else going on and they need to be evaluated to figure out what is wrong with their low back or neck. When a patient comes in my clinic, first what I like to do is sit down with the patient and learn about what's been going on with them. That's, do an extensive history, spend the time with the patient to find out why they're hurting, where they're hurting, how long they've been hurting. And that's in addition to a physical exam to see if I can't evaluate the nature of the pain that the patient's having. When patients come to my clinic, this is a perfect example of what a patient might be experiencing that could be causing their low back pain or leg pain, or even their neck pain and arm pain. This is a herniated disc, or an example of a herniated disc where the nucleus pulposus, or the center of the disc material, has actually excreted through this annulus fibrosis. When this happens, this can cause spinal stenosis. It can actually impinge upon nerves in the spinal canal itself, or if you can imagine a nerve root coming across this, coming out, exiting to your leg or your arm, and it actually getting pinched off by this herniated or bulging disc. What the Acuroscope procedure does is it addresses a condition like this. The laser energy is focused right here on the actual bulging or herniated disc, where it can reduce the herniation and improve circulation to the nerve and reduce impingement on the nerve, and patients can have immediate improvement of their symptoms and pain.
Coming up after the break, we sit down in the studio with LASIK eye surgeon Dr. Harvey Carter. Plus, we'll learn the nutritional value of eggs in our Healthy Living segment.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
Hi, and welcome back to the Best Docs Network. In the studio, we're joined today by Dr. Harvey Carter, founder of Carter Eye Center and one of the top LASIK surgeons in not only the Dallas-Fort Worth area, but in the country. It's a privilege to have you here, Dr. Carter. Thanks for joining us.
Thank you for having me.
Now, you were the first FDA investigator to perform LASIK surgery in North Texas. So you're obviously an expert on the subject matter. So I'd like you to talk to us just a little bit about LASIK surgery. If you would start off just by taking us through the process.
The process today is really just dramatic in terms of its ability to rapidly change someone's life in a matter of minutes. Today's technology is blade-free, all laser vision correction. On a surgery day, the patient comes in and they sit in a very comfortable room where their eye drops are applied. They get a light sedation with Valium or something like that if they want, chemical courage as it's called. They then go in the laser vision correction room, and in that room we have a laser that makes your flap. So you have a flap made in your cornea. We have another laser that takes your personalized prescription from your eye and lasers that prescription directly onto your eye.
Wow.
If your prescription was whatever it was in your glasses or contact lenses, it can be literally sculpted onto your cornea so you can throw away, hopefully, your glasses or contact lenses. You put the flap back and they go out, and the entire procedure from walking into the room to walking out of the room is usually less than 5 minutes.
Oh, wow, that's amazing.
Isn't it great?
Absolutely. And if a patient has LASIK surgery, will they be glasses free for the rest of their life, or is it possible that their eyes will regress and they'll have to have surgery again? There
are a variety of ways of doing LASIK surgery. LASIK in general will treat nearsightedness, farsightedness, astigmatism. So it will basically reduce or eliminate the need for glasses for anyone under the age of 40.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Eating eggs for breakfast not only tastes good, but they help to slim you down. Each egg you eat has 6 grams of protein, but only 72 calories.
Well, my goal is to give people what they want as much as I can, and usually I can do that. I pretty much have been blessed where there's not very many people that say, I can't help you. In fact, I can't really think of anybody. We try to give them a great smile. We do a lot of things that other dentists have told them, well, no, I can't do anything to help you. And I've actually had dentists who refer patients to me, so I'm very honored by that. We try not to just go in and just do it a cookie cutter type, one size fits all. I try to individualize it for the teeth because I want to be as conservative as I can. I want to do it as comfortably as I can for people, minimal invasion on their tooth structure that's in good shape. So I'm not just trying to talk everybody into doing veneers or doing crowns or whatever. I mean, some people come and want that, and that's fine, but I try to give them options. I try to say, yeah, that is an option, but here's another option, and this might be better for you because ABC. And so we try to work with them and work within their budget and what they can do and what they want to do. What I love about what I do is how it changes people's lives, especially someone who was unhappy with something that had done earlier that came here to get it fixed. Because they're more desperate sometimes than the people who had anything done. They're disappointed, they're hurt, they were wanting something and they didn't get it. And to be able to take someone like that and to show them it's okay, it can be fixed, it can look fantastic, and to take them and to guide them through that and help them achieve what they wanted to achieve originally and fix it for them is really satisfying. It really makes you feel good about what you're trying to do. I had one guy in with his wife, it's like she won't shut up about her teeth, you know, and she's talking to everybody about it. And so I love that. And, you know, getting Facebook posts from patients and talking about how I love my dentist and things like that. I mean, that's awesome. There's a lot of satisfaction in that, and I really enjoy that.
For more information and to check out hundreds of videos on all the amazing doctors that you see on our show today, head to our website. It's bestdocsnetwork.com.
All right, Grace, now to our next best doctor. It is cosmetic surgeon Dr. Michael Thornton, who helped a yoga instructor, Taya, get her figure back.
I'm a yoga instructor and fitness instructor, and I've had 3 babies. And after having all 3 babies, I started to realize that no matter how hard I worked, no matter how much weight I lost or how much muscle mass I put back on, I wasn't seeing some of the changes that I wanted to see.
When women have children, their muscles and their abdomen separate, and they sometimes don't come back. And so what happens is that's how they get the little pooch in the lower abdomen region, and it stays there for life.
Before I met Dr. Thornton, I didn't know what I was going to need to have done in order to feel like myself again.
She had a very interesting problem with her abdomen, meaning that she didn't have a lot of skin to remove, but she had a huge separation of her muscles.
He convinced me and explained to me the things that I needed to do, and that no matter how much fitness I did, I wasn't going to see the changes that I wanted to just because of, you know, having 3 babies and what it does to your body.
I came up with a plan with her. It's called an umbilical float. You can't force that procedure on everyone, and you have to pick that person exactly. And Taya was the perfect person, so she had a mommy makeover. With her, I did the minimally invasive tummy tuck, where I just make a small incision in the bottom and I release the belly button, and it allows it to float upward. And then I go all the way up to almost near the breastbone, and I sew up her muscles all the way from the breastbone all the way down to her pubic bone. And that literally brings her abdomen back into its normal alignment, so it gets real tight. And then I just stitch her belly button exactly back down where it was before, and then I pull out the excess skin. Well, good candidates in particular for mommy makeovers are just women who are between the ages of 35 and 45. That's kind of our average, that have grown kids and now they want their body back. Usually it's some sort of breast revision surgery in combination with abdominal revision surgery. So when you're done, they have improved breast and they have improved abdomen. And that's really what the mommy makeover is.
I am so glad that I went with Dr. Thornton. I'm so glad that I had this procedure done, because I feel like myself again. I now feel like I look how I feel. It was probably the best decision I ever made.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
I had gone from such an active lifestyle to a life of where sitting, standing, sleeping, trying to turn, trying to walk, getting up off the sofa was a major ordeal for me. Any kind of movement or non-movement was excruciating.
Brenda is in her 60s. She came to me because she had severe arthritis in both of her hips. She had seen other doctors. One doctor prescribed injections, but they only lasted a few days. So we found that she was indicated for bilateral hip replacement because she had severe arthritis in both hips.
After an examination, he goes, I have good news and I have bad news. And he says, well, the bad news is both of your hips are in really bad shape. He says, you're going to have the bilateral hip replacement. The good news is I can do it, and I'm happy to do it. Dr. Toulson also had a model of the hip, And he said, this is what the procedure's gonna look like. And he talked through the whole thing and he says, you're gonna be a new person once you have these hips in.
It takes about 6 to 8 weeks for a patient to recover from hip replacement. But when you do both at the same time, it literally takes about the same amount of time for them to recover. This in particular makes bilateral hip replacement an ideal surgery when you have the perfect candidate. Because Brenda was very healthy, we were able to accomplish both hip replacements in one setting.
After surgery, I woke up and I cannot begin to tell you how wonderful it was. I was without the pain that I'd had over 2 years.
Brenda is doing amazingly well. She is just so happy and happy with life. She walks 3 to 4 miles a day. She has no pain. She's able to do everything she wants to do in her life, and we're extremely happy with her outcome.
I just cannot thank Dr. Toulson enough for giving me back my life. It's truly a gift, and I will be forever grateful.
Stay tuned because we're just a minute away from learning about managing chronic pain in our Medical Minute. And after that, we'll see how Dr. Yadro Ducic helps a young woman shine with a rhinoplasty.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
I see a lot of patients with chronic pain. Chronic pain syndromes can affect your entire life, work, home, everything. There's a lot you can do to help yourself with this, and a lot your doctor can do to help you. First of all, try to avoid narcotics. That's a dead-end street. It just covers up the pain, and the pain's still there, and it's going to come back. When you have pain today, your body produces something called substance P. Substance P magnifies tomorrow's pain, and you get in this cycle of pain, substance P, magnified pain, more substance P, and it just is a vicious cycle that keeps going on and on. So what can you do about your chronic pain? There's a lot you can do. Physical therapy helps. Getting appropriate and restful sleep will help you. If you have depression, either from the pain or just depression from depression, antidepressants can help that too. There's also a lot of medications that your doctor can use that will help reduce the pain and stop that vicious cycle of substance P and magnified pain.
For additional medical minutes from Dr. Honaker, log on to BestDocsNetwork.com and click on the Medical Minute tab on the home page.
I've done dance a majority of my life, ever since I was about 2.5 when I first enrolled in tumbling. And over the years, with mirrors and makeup and performing, I kind of realized something's wrong. I noticed my nose was not always the best it could look.
Well, rhinoplasty essentially means reshaping the nose. When you look at the nose, it's in the middle of the face, and we don't really want to draw attention to the nose, whether it's positive or negative. The whole point is you want people to look at your eyes, you want them to look at your smile, your mouth, your overall facial appearance, and the nose you don't want to be a distraction. In terms of aesthetics, you really want to make the nose fit your face.
Dr. Ducic is very open, he's extremely funny, he's very relatable, he gets very involved with his patients. He really tries to figure out how and what needs to be done to get the achieved goal.
In terms of when to have a rhinoplasty, appropriate age is when patients are mature enough. You have to look at the facial features and facial growth. Sometimes you can do corrective nasal surgery on patients as young as 13 and 14 if their facial features are fairly well developed. Sometimes they're not ready till they're 17 or 18 or 19, and so you really have to individualize it. It's important to have a nose that is appropriate for your facial dimensions. You don't want a nose that's too small and somebody with wider cheeks. You don't want a nose that's too large or too prominent. And so it really is a matter of balancing it with the rest of your face.
He explained to me that, the balancing my face was off. He not only recommended a full rhinoplasty job for alignment on my nose, but he also recommended a 4mm implant to my chin and my jaw so that it could help balance out my face. Now, to this day, about 4 or 5 years later, it has definitely made an improvement. I'm definitely more confident. And now with my greater confidence, I've actually been able to have some modeling opportunities and gotten to actually show off my new presence and appearance.
For more information about any of the outstanding doctors you see on today's show or find the right doctor for you, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Now it's time for our next best doctor. That is plastic surgeon, Dr. Robert Wilcox.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest. So it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient, and the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid. So about 9 years ago I came up with a new idea. No scar at all on the chest, no drainage tube. We're able to remove the two components of gynecomastia, the fatty tissue and the glandular tissue, through an incision this long under each arm. And there are two instruments that allow us to do this: the use of ultrasonic liposuction, and we have a multi-jointed cutting device. We're able to cut out the rest of the glandular tissue with an instrument that goes through this incision all the way down to the nipple. After we've cut all it out and it's perfectly flat, the last thing we do before closing the incisions is to re-inject the entire field with a long-acting anesthetic called Marcaine. So when the patient gets up, we've already got the compressive garment on, they're pain-free. They're typically only in the recovery room 45 minutes to an hour, and that stays numb till the next day. They wear the compressive garment under their street clothes for 3 weeks, and they're done. We see them at 8 to 10 days post-op. We see them 6 weeks after that, 3 months after that, and they're delighted.
That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And to find the right doctor for you, head to the website, bestdocsnetwork.com.
And if you have a question, a comment, or a life-changing story of your own, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.